having a healthy set of teeth with impeccable oral hygiene is not an easy task.
You have to build a routine since the child is very, very young. We ask parents to start brushing their children's teeth at the age of 6 months. With some of the formulas, they cause teeth staining. So that's why the formulas we are recommending are the one that does not cause the tooth staining.
If a patient is starting to show anxiety, and at one point this patient can actually hold your hand. Demineralization, I know as Wagida, that it happens due to many reasons. One of them is actually aging. Like the skin loses collagen, okay?
Yeah.
The teeth will get to the point of losing enamel.
No.
Is there...
Okay.
So you said brushing your teeth 6 or 7 times a day.
Yeah. If you drink coffee and tea and you don't clean with water, at least rinse, the stain doesn't go away. In this case, if you really want white teeth, there are the options of ultra veneers, which are very, very thin veneers without teeth preparation. Even toothpaste, the same. There are a lot. I know you want to ask this question.
Yes.
Even toothpaste. There are commercial toothpaste. Yeah, there are commercial toothpaste, like shampoo. God, there are commercial shampoo.
Hi everyone. Hello again and best greetings of the day to all of you. My name's Wagida and I would like to welcome you all to a brand new episode from Podcast with Wagida. Today's podcast, before you start thinking and digging deeper into what today's podcast will be about, let's have a tiny bit of a riddle. They say that one's smile is the window to their soul. Did you get it yet? You did. It is about your smile. It's about my smile. It's about everyone's smile. The teeth today is going to be about teeth. The smile is not about the teeth. When we say it's the window to your soul, it's because some people smile with confidence, and it's not because they have a very beautiful set of teeth. It's because they're quite happy, content and satisfied with what they got. Some others don't have that much happiness or satisfaction about having a big, wide, massive, genuine smile coming from the heart because they want to hide their teeth. For whatsoever reason, they do this when they smile or they look down. Some of them even lock their lips. So, some people have confidence to smile and not bother much about their teeth, whether they look good or not. But the problem is not about how good they look. Problem is actually about how healthy they are. Today, we're going to be discussing with our guest, the pioneer, the expert with her 32 years of experience being a dentist. We are going to cover so many aspects of having a healthy set of teeth and what might affect that healthy set that you have that would push you or force you to think that you need to go cosmetically to look after your smile and get that Hollywood smile. Today, with our guest, we will talk about daily routine, daily oral hygiene, daily care, periodic visits. Why do you need to visit? When do you need to visit? Signs to watch for, causes of the problems that make some people hide their teeth. Today's guest is Dr. Hibah Shata. And for you to know a little bit about Dr. Hibah herself, she has her own dental clinic, Dr. Hibah Shata Dental Clinic. In 1997, she was appointed as Associate Consultant in King Fahd National Guard Hospital in Saudi Arabia. In 2016, she became a board member with Jordan Business Council in Dubai, UAE. In as early as 1993, she received her fellowship from the Royal College of Surgeons in Ireland for the general dental surgery. Dr. Hibah, thank you so much for taking the time out of your busy schedule to be with us today and with the viewers to enlighten them with your knowledge and experts that you have acquired over a long journey of 32 years.
True. Thank you very much, Wajida. It's really a pleasure and an honor to be among this beautiful program. At the same time, I think we all have a message to deliver to our community and help in better life for whether it's a child or an adult or anyone who is looking after his health and well-being.
Thank you so much. Now, let's get going. You're a dentist.
Yes.
Dr. Hibah, having a healthy set of teeth with impeccable oral hygiene is not an easy task. It is not an easy task. It requires daily routine.
True.
It requires periodical visits to the dentist.
Yes.
However, so many people are scared of dentists, and I'm the first on the list. Okay, I will not ask you why people are scared of dentists, because each and every one of them have different trauma.
Honestly, you have to build a routine since the child is very, very young. We ask parents to start brushing their children's teeth at the age of 6 months. Use this little rubber finger plastic.
I used it on my boy.
Exactly, with a little bit of rough plastic, so they can rub the 2 single teeth that the baby have. And then the child is growing with these good habits of brushing his teeth once in the morning and once before he goes to bed. This routine will prevent them from having real problems when they grow up. People, I would say people, client, patients, everyone goes to the dentist when either they are having pain or they are having like broken tooth or afraid of having pain. So as for prevention, why are you going to the dentist? Because you're afraid of that the tooth will break, and then if you have too much care.
Or touching the nerve.
Exactly. So pain is not a pleasant feel. And thinking of it sometimes really scare people, make them very anxious. And this is why it's very important to raise the awareness of the public towards the importance of taking care of their dental hygiene and oral health habits, especially in schools. There are many programs today are implemented within the school premises to help children understand the need of eating less sugar, brushing their teeth after each meal, going to the dentist every 6 months, putting fluoride on their teeth regularly. All these measures are prevention measures so that they can grow up without having decay, without having any problem, and they can live their life to the optimum. And then their dental visit won't be scary or unpleasant, because it's really a regular checkup where they just remove if there is any tartar, help, in children we do something called fissure sealant. And these are little it's a resin material we put in the small little creaks, I don't know what you call it. We call them fissures in the tooth. So because they harbor the food debris and they become carious very easily, we tend to close them and block them with resinous material. And then there is the chance of having a decay is reduced a lot. So these are some of the things, prevention measures that we help parents to understand that they need to put them for their kids in order to have them having a healthy dental life, and they wouldn't need to go to the dentist because they are in pain or they have a problem. The other cases where people seek dental help is when they break their teeth, like athletes or sports, or falling on your knees or on your, while playing football. A lot of even young adults or adults chip their teeth or break them. So that's where they also seek dental care. So yeah, the other instance where people seek dental care is when they break or chip their teeth. We see it a lot while they're playing sports, for example, falling and breaking teeth. And here it is important to seek a dental care because it's important to reconstruct and rebuild that broken part of the teeth.
When you receive a patient who is scared of you, and this patient had to visit you,
definitely,
and you start on the treatment, and the patient is starting to show anxiety, and at one point this patient can actually hold your hand so you don't. I'm quite confused.
It happens all the time. It happens all the time.
How do you handle this?
Okay, so there are two scenarios. Like the first thing is, it happens a lot with children because they come to the dentist and they don't want to be there. For them, seeing the white lab coat reminds them of the injection of their vaccination. So the minute they step in, they are already anxious and scared. And then there is the adults who have bad history in their background memory from being victim to bad dentistry or having someone dentist forcing them to sit and extracting their teeth and doing some painful procedure. So they grow up with a fear of going to the dentist. So we have seen these two scenarios. Now, for children, you start by getting them familiar with the place. We start, because we work also with special needs kids, so you still have to follow a protocol or a routine to make them familiar with the place. We do something called tell, show, and do. So we tell them what is it like, we show them the teeth, we let them play with the instrument, we have the air syringe and let them blow some air. Sometimes we blow the gloves and make a face on it. So the first time with children is more of
building
having fun and building the relationship. And we used to have, these glasses where you can watch a movie while you are sitting on the chair. So we can also trick them into watching a movie. And you take it step by step. So the first time is just like counting their teeth. You have good teeth. Maybe we put fluoride gel because it's not a big procedure. We use sometimes even cotton. And then maybe after the second visit or third visit, when you start to do a proper procedure, because the child is more trusting, and we also reward. So when it's a child, after he finished, you give him a sticker or an eraser. No, definitely not a chocolate bar. We don't give chocolate. We give things that they like. So we ask the mother, what does he like? He like a car, or she like a doll, or she like a Barbie. So we give them something to bribe them to come and sometimes it's like we have like you have a little, I wouldn't say candy, but something like a gift basket, and they can choose what they like. So they are looking forward to come next time because there is something else that they might like and they can get. So this is how you build that relationship. For adults, it's different. For adults who are very, and by the way, I used to work for the military in one time of my life. I worked for the National Guards, and I used to have generals in the army with like the 3 stars and the crown on their shoulder, and they have a pistol in their hand. They put it on the table, they sit down on the chair, and they say, "Doctor, I'm scared." And I look at him and said, "You have the pistol, I am the one who's scared." So a lot of people, the fear does not have anything related to their position in life or what they do.
How strong they are.
No. I've seen men who are very, very scared. Not only women, but also men. It depends on what kind of history you have with a dentist as you are a child. So if you've been to a dentist who have given you a very traumatized experience, and we've seen that a lot, that they go to 3-4 dentists and each one of them try to force them on the chair, remove, even it's a baby tooth, but still they remove it with force. Then you end up having a child who grow up with a big hate for dentists and a big scare and anxious. So in these cases, we start by talking to the patient and trying to establish the relationship, give them some control. So one of the things I tell patients, if you feel anything, just raise your hand. I see your left hand. I will stop immediately. So you give them some control and autonomy so they know that they are the one who can decide when to stop. And this is very important. And then you start also by giving them a very mild procedure just to get them to get to know you, like scaling or polishing the teeth, something that is not very invasive. And this is when you start to get them relaxed on the chair. So the second visit, they are more prepared to accept. For some patients, and this is the extreme, who are very, very nervous, we sometimes give, like diazepam or some relaxant and medication. And we give it to them like the night before, the morning, 1 hour before they come. So by the time they arrive to the clinic, they are very calm and they are able to take the procedure. We don't do it for everyone, but in the extreme cases when they are really, really anxious and very, very scared and they need to do the procedure, so we can give them some relaxant to help them to, calm down and be able to tolerate the procedure. Some of the tricks we do is to give them a break every now and then, like every 10 minutes. minutes. A lot of patients also breathe from their mouth, not from their nose. So when you're opening the mouth and your hand, 2 hands inside his mouth, it's too much phobic. Like it's really scary for them. So we have to give them sometimes break, like every 1 minute. I tell the patient, just raise your hand and I will stop. And then we give them a break to breathe and relax again, and then we start again. As I said, there are some of the tools we use, like the camera, the movie glasses, and they're available now. They use them for the 3D, and a lot of people they don't even feel that because they're so much absorbed in the noise and in the scenes that they are seeing, they forgot that you're working on them. We used to have a massage, a massage. It's not a massage chair. It's a little massager that you put on top of the chair, so it can also relax them. In the beginning of my career, I used to do manicure and pedicure. That's another way to help patients relax and have their nails done. I don't do it anymore, but in the beginning we did that, and we had a small spa within the clinic so that they are really relaxed and enjoying. And these are some of the things that we use to help anxious patients. Yes.
Speaking of anxious patients, and I will speak about myself here, being someone who would like to go and get my periodic cleaning done. Unfortunately, I over-brushed my teeth over time, and this caused receding of the gum in certain areas. And when I go for the cleaning, even if they are doing the air flow cleaning, it still gets to a part of the nerve, and my teeth are already extremely sensitive from when I was very, very young. The question for so many adults watching here and would like to go and have their teeth cleaned, can they request you to give them anesthesia to numb the parts?
Yes, you can.
So that you can do the cleaning without them feeling anything?
You can. I mean, if you want to talk about gum, because there is the dental part, which is the hard part, and then there's the soft part, which are the gums and the tissues around the teeth. The health of the gums is really very much related to 2 things: to the oral hygiene habits and the general health habit, like you're diabetic or whether you are a smoker. All these affects the gum health. So people with low immunity, for example, it affects their gum health, because the gum is one of the first lines of protection in the oral tissues. It has a fluid, it's called crevicular fluid, and it has the immunoglobulins that fight the bacteria in the mouth. Now, if you happen to have low immunity, or for example, uncontrolled diabetes, and also disorders of the general system in general, like you're weak, you're always sick, your immunity is low, this weakens that defense system, and it causes the gum fighting the bacteria, result in recession and losing that important tissue that anchor the tooth inside. So in the outside you have the gum, but inside you have the bone, and the bone is the anchor to the teeth. So when it becomes diseased and disturbed by bad oral habits or by medical condition, you start to have gum recession. Now, there are other causes of gum recession, as you have mentioned: brushing the teeth with hard toothbrush or hard technique. So you might have a softer or medium toothbrush, but you are forcefully rubbing your teeth and you're rubbing your gum very strongly. This causes recession. The other thing is if the toothbrush bristles are old, so people have to replace the toothbrush every 3 to 6 months. I've seen people who are using the same toothbrush for years, and it opens and it becomes like a hairbrush, but still they're using it because they like.
Doesn't this promote bacteria?
Of course. No, it's not about the bacteria because it's bristles made of plastic. It doesn't harbor bacteria, but it becomes very, very unuseful. Like, it's not useful at all because it doesn't brush anymore. It's like rubbing, and it will remove the enamel of the tooth and it will hurt the gum. So it's very important to replace your toothbrush once you notice that the bristles are no longer strong and straight, or after 3-6 months. It's the time to change the toothbrush. Now, some people use electric toothbrush.
Yes.
Some of these toothbrush are also very rough, or are used wrongly. So you don't put it for a long time on the tooth because you end up rubbing away the enamel. So again, using the electric toothbrush should be used with like a sense of realizing that I don't overdo it because it goes very quickly. And then people tend to keep it for a little time on the tooth, and then this causes also tooth wear.
How many seconds should I keep my electric toothbrush, or how many seconds would I brush the teeth?
I wouldn't say seconds. What we used to teach the clients is to use disclosing tablets. So these are tablets that dye the teeth red or blue. And then you use your toothbrush and clean and then rinse. And if you still have red stains, you go and brush again. I have a dentist friend of mine. He always tells the patient, imagine a washing machine. You put the clothes. How many times they go on and on and on to get clean? Sometimes 3 times, sometimes 4 times. So the same, like you have to clean them until they are clean. It doesn't matter if it's 10 seconds or 1 minute or 2 minutes. It's more important to have make sure that there is no more plaque on the teeth. And if you spend 1 minute going around, but still there is plaque, it doesn't really clean your teeth. And a lot of people just use the brush like this, and that's not the right thing, because the food does not only stay on the surface, it is always accumulating in between the teeth and between the gum and the tooth.
What's the right
so your
way?
Technique is to have the brush at 45 degree angle and brush the upper teeth downward. So you're taking the food from the gums out, and the lower teeth upward. So you're taking the food out. And when it comes to the front lower teeth, you go up and down. And in the upper teeth, you still use the same technique for the upper.
And this
is how you do it.
The electric?
It doesn't matter, any brush. I mean, the advantage of the electric, I really like it for people who have poor manual dexterity. They are not able to control the brush very well. In children, it's very useful because a lot of children, they really don't brush. They just, go around.
Yes.
So with the electric brush, you can have better results. And elderly people, they benefit a lot from the electric one. In between that, there is also, I don't know if you have heard of it, the air floss.
The air floss,
which is basically spraying air in between the teeth. And this is a very useful tool. Because a lot of us, you know the dental floss, we always advise that you brush your teeth and you use the floss once before you go to bed.
Yes.
Now we have big hands, and a lot of people have small mouth, so you cannot put both hands inside your mouth.
Yes.
So the floss now, you have like a small toothpick with a floss at the end.
Yeah.
It's useful. And a lot of time I found people, especially older people, who cannot really hold the floss because you're using your finger and you have to insert one hand inside and one outside. So a lot of time they don't floss. They don't floss at all, or they floss only the front teeth and they miss the back teeth. So the air floss is a very useful tool because it helps them to reach implant patient, orthodontic appliances, like with the orthodontic brackets. The food goes in between the wire and the bracket. And when we remove this bracket after 2 or 3 years of treatment, we a lot of time find decay under the brackets because the food gets there and doesn't go away, and they cannot floss. So the best here is the air floss because it really removes any food debris in between the teeth.
And the water floss.
The water floss, and they call it air floss or water floss because it's air and water.
I had one before that only had air with a spritz, a splash of water. The other one is just a stream of water.
I prefer the water with pressure because the pressure is the one that removes the debris. So it's not the water. The water is fine, but it does not remove the debris. The pressure, the air pressure, that like this splash, is the one that pushes the food out.
I have to admit that I got it when it was first released. I will not say the brand. It was about $120 or more. And I got it from Hong Kong. It was not even released here. Tried it, and because it's very small, very handy, it's the size of the toothbrush. You take it anywhere with you. You put very little water and you use it. It's supposed to be giving you the pressure of the air with a spritz of water. And I tried it and tried it and tried it, and it's like, no, this is not, it's not working. It was...
Well, the technology have evolved a lot today. I mean, in the past, we used to have like a big water tank and a pipe, and then you press, and you have to have this carried with you when you're traveling. Now it is wireless. You charge it and it stays with you for 2 weeks.
Yes.
And you have a kit, travel kit, so you can put it in the box.
Yeah.
The other nice thing about it is that you have now levels. So you have level 1, 2, 3.
Yeah.
So it can be strong, can be weaker if you like.
And it can be
to be honest, after trying it with so many patients, when they come for their dental checkup, I don't find anything. There is no caries, there is no tartar, there is nothing. So I really strongly recommend them because it really gives a very healthy, and you just have to use it once before you go to bed. You don't have to use it 3 times a day. You just use it once. And sometimes I tell patients, if you don't want to use it once, at least once a week, at least, so that you can make sure that your teeth are very clean. But usually it's a replacement for the dental floss, because we really advise people to have to remove the food going in between the teeth. And if you are not using a floss, this would be the alternative. And it's a very easy to use, and it's predictable results. And I've seen the effect of it on all my patients. Almost, they come for the dental checkup. There's very, very little to do for them. And this is very important, especially when you have implants or when you have orthodontic wires, because here you have areas where food will definitely get impacted.
How about with veneers?
Yes, I'm saying in general, but I'm saying when you have areas that you expect the food to go in there, you definitely need to have something to work with, yes.
Before moving on, I would like to touch on that sealant that you have mentioned earlier. Okay. Some use it for the kids?
Yes.
And the question is this something that you can use for adults as well?
Of course. Because the idea of it is prevention. It's called preventive restoration. And they call it fissure sealant because it's more easy for parents to understand, but it is a prevention restoration. So whenever we have a pit or a fissure, and pit means a little deep area,
yes,
that we expect the food will stay. And if it stays, it will have acid, and this acid will demineralize the tooth, and then it will start decay. So to prevent that from happening, we put fissure sealant. It is useful for adults, for children. I mean, we start it when they are children, but as they grow, we replace it. So
of course.
So we use it all the time.
How long does it last?
4 years, 5 years, 7 years. It depends on your habits. Like if you are... most of the restorations have, if it's a resinous restoration, the shelf life is 7 to 10 years. But I have seen restoration that lasts for 20 years. But I wouldn't tell you, look, leave it for 20 years.
No.
I always think like between 5 and 10 years, definitely you need to replace them. Mm-hmm. But because we do every 6 months dental checkup, when we see that the color have changed, or the margin is opened, or there is stain around it, or it is fractured or broken, we definitely have to change it. So when we look at when we check up your teeth, we will definitely know that, and sometimes we take x-rays to see if maybe it looks intact from outside, but inside there is decay. So these are the cases when we really have to replace them, and maybe at that time, if there's caries underneath, you have to put a restoration, not a prevention restoration. But yeah, it's very useful.
I've seen on one of the social media platforms that mouthwash is just something commercial to increase the profit of the manufacturer. So mouthwash, is it something that helps with the oral hygiene every day? Or
yes, there are several types of mouthwash. There is the commercial mouthwash, like a commercial toothpaste, and then there is an adjacent mouthwash that is scented with, let's say, mint.
Yes,
these are called like a mouth freshener. So it makes your mouth feel fresh, smells good. They don't have any chemical chemical formula that is useful for me as a dentist, because we use mouthwash to prevent infection. We use it after surgery. We use it when we see that there is a lot of gum inflammation, because the mouthwash that contain chemicals that kills bacteria, it's important to use them when we have infections in the mouth. So we use them as therapeutic. So the therapeutic types of mouthwash, for example, they have chlorhexidine mouthwash. This is a chemical that kills the bacteria. And I use it personally whenever I want the mouth to be no bacteria. I don't want bacteria because I've put an implant, I have a surgery. I don't want to have any infection in that site. So I would definitely use the mouthwash. But we don't use them for life. I will use them for 1 week or 2 weeks or 3 weeks or 1 month. If I have gum disease and I clean the teeth and I want to make sure that I'm reducing the amount of bacteria in that case, then definitely I will use a chlorhexidine mouthwash. Now there is other medical
those
components.
Are prescribed ones. I don't just go and help myself and get.
Sometimes they are available. But again, it depends on how much knowledge you have on the chemical formulas. So, for example, some of the formulas have 1%, they have 5%, they have 0.5%, they have 1.2. So these concentrations are for different uses. Most of the people don't know that. And then there are the mouthwash that you use them because you have dry mouth. So there is one brand that produces mouthwash to keep your mouth lubricated, because some patients or some people have medical conditions where they constantly have dry mouth.
Yes.
And when you have dry mouth, the chances of you to have decay, gum recession, a lot of problems is high. So in these cases, we have to give this, to keep the mouth moist instead of the saliva, we give a mouthwash. But in these cases, they have to use it like 6 times a day, because you need to have the mouth completely, all of the time, moist. And we have even sprays or sometimes toothpaste and sometimes gels to keep the mouth moist. There are uses definitely there are uses. Whatever article or whoever wrote it is just trying to tell people, consumers, be careful of purchasing things that you think is going to kill bacteria, but it's really a mouth freshener. And in that sense, yes, there are a lot of products that are used by smokers to give them a better mouth, odor. But they are not killing bacteria. They are just there for the fresh feel. There are also some alcohol-based mouthwashes, like they have alcohol in them. And we don't recommend them when we have implants, for example, because they can cause rusting and things like that. So we are, and also it dries the mouth.
Of course.
So if you have an old patient where the gums are very, very fragile, you don't use alcohol-based mouthwashes. It's an interesting topic, very interesting.
So what would you recommend in terms of when I want to go, I don't have any problems, I just want to use my regular routine, brushing in the morning, brushing at night, flossing once at night, followed by a mouthwash. The mouthwash for me, it would be to kill any bacteria that is left.
I would suggest you go the light formula of the bacteria killing mouthwash.
Okay.
So you go for the very light, which is, I think, 0.05%. So I use it as maintenance. So I tell my patients, especially if they have gum problems or they always have smell in their mouth, you can use it. You can use it even 3 times. The only problem with some of the formulas, they cause teeth staining. So that's why the formulas we are recommending are the one that does not cause the tooth staining. But the light, if you don't find the light, you can always dilute it with water. But it's very important to keep that bacteria count down. So the mouthwash. I am using it to keep the bacterial count down. And it will work whether you are a smoker or whether you're having bad breath or whether you're having an infection or gum disease.
Coffee as well. Coffee is one of the things
there's no relation between coffee and mouthwash.
No, talking about some people are suffering from bad breath, but back to the mouthwash, the advice would be, in general, if you want to have the right mouthwash, the doctor said that some of them might cause staining as well.
Yeah, it would say like bactericidal. You will read the word on the mouthwash, bactericidal, means it kills bacteria. And then you go for the formulas that are not very...
From the dentist, like visit the dentist.
Yeah, it's always okay. The advice is to have a dentist prescribe it, exactly.
That's it.
Yeah.
That's it.
The on-the-counter, even toothpaste, the same. There are a lot. I know you want to ask this question.
Yes.
Even toothpaste. There are commercial toothpaste. Yeah, there are commercial toothpaste, like shampoo. There are commercial shampoo.
Yes.
So, and then there are the shampoo that are for your hair, that because your hair is very fragile. The same with toothpaste.
Okay.
So the toothpaste, there are commercial toothpaste, and then there is a medicated toothpaste.
What do we look for when buying?
It depends. You have if your dentist. Okay, if I'm going to use a toothpaste for my child, I will use the children flavored toothpaste, but I will choose the ones that are not abrasive. So when you put the toothpaste between your hand and you rub it, it is jelly and it's not having little bit of powdery effect.
Should it contain fluoride?
Yes, definitely. Definitely. Then if I'm looking for me to use a toothpaste, depending on what is my goal. So if I have teeth sensitivity, I will go for sensitivity toothpaste.
Yes.
If I have gum disease, I will go for the ones that have, it has medications to kill the bacteria and help with the gum. Yes. And these are commercially available, but also are prescribed by the dentist. So a lot of dentists, we give this to the patient and tell them always buy from this brand. It's always available everywhere. But they're always more expensive. Medicated toothpaste are not it's not 10 or 15, and they're always 25 dirhams or above. So that's why people sometimes feel like, oh, it's too expensive, I don't want to buy it. But these are the ones that we recommend. It depends on your case by case. So if your dentist suggests that you use one of, I don't want to say the brand, but let's say this is for gum disease, then it is helpful for you to always buy that kind of toothpaste, as long as it's not abrasive. Because most of them, they do the same effect. It's lubricant to remove the plaque from the teeth. Yeah. But the rough one, which have powdery effect, they rub away the enamel. So imagine someone who brushes 6 or 7 times a day and using an abrasive a rough toothbrush and an abrasive toothpaste. What would happen to the teeth? They will completely wear off the enamel. So that's why we ask for a soft toothbrush, a non-abrasive toothpaste that has fluoride, and then the medicated ones are used based on cases. So if you're having sensitivity, then you can use the anti-sensitive toothpaste. If you have bleaching, sometimes people have tooth whitening, so they go for the tooth whitening paste. If you have normal teeth and you don't have any sensitivity or tooth whitening or gum disorder, you can use any of the commercial as long as it's not abrasive.
You said brushing your teeth 6 or 7 times a day.
Yeah. I know people who every time they drink coffee, they go and brush their teeth.
Is it a good thing?
Is
it not overbrushing?
That's true, but sometimes people are obsessed. There are people who are obsessed with cleanliness. They wash their hands all the time, and it can happen. I've seen cases like where people are, and here I tell them, can you please just focus on 3 times a day? I don't want you to overbrush. Because a lot of people just feel like, I can't tolerate any food in my teeth. So every time they eat something, so they eat a biscuit and they go brush. They eat lunch, they go brush. They eat dinner, they go brush. They eat something in between. So it is not healthy. It's not good.
What's the healthy count?
It's 3 times a day. I always recommend after eating. I mean, most of us, we do it when we wake up in the morning because it gives you a fresh breath.
Start of the day,
But then usually, why you are brushing? You're brushing to remove the plaque and the food debris. So when that happens, it's after meals. So after lunch, definitely you need to brush. And I always tell children, take the brush with you to school, go to the bathroom and just brush after meals. Especially if you have orthodontic treatment, for example, because then you have the wires and the brackets and the food goes in between. It's important to clean the teeth. If you have a bridge, because the food goes sometimes under the bridge. So it's very important after meals to clean. And then at night before you go to bed, because again, you already have your dinner. So at night so the most important brushing for me is the one at night.
Yes.
Why? Because when you're sleeping for 9 to 12 hours and there is food debris on the teeth and there is plaque and bacteria, this is the chance when decay and caries and gum disease, everything happens, because you have 12 hours of humidity, warmth, a place for bacteria to grow and multiply. So it's very important the night. And if you miss brushing throughout the day, do not miss brushing at night at the end of the day. It's very important.
Doctor, we covered demineralization very, very briefly.
Okay.
Demineralization, I know as Wagida, that it happens due to many reasons. One of them is actually aging. Like the skin loses collagen. Okay, the teeth will get to the point of losing enamel.
No.
Is there... So
no, it doesn't. You don't lose enamel. Let me tell you.
Demineralization.
Yeah. Okay.
Does it happen to everyone or some?
No.
Okay. If it happens to someone.
Let me explain to you what we call demineralization is basically tooth wear, in general terms. Okay. Now, Teeth wear means you are losing the structure of the tooth. When we are growing up, the teeth are, during pregnancy, they are made inside our mouth, but they don't grow out until we are born. So at 6 months, you start to have the first 2 teeth, and then the other teeth are in the making process. And that's why we tell parents, give milk to the child, because the milk is important because of the calcium that goes in. It makes the mineralization of the teeth. So the process is you have a gelatine-like framework, and then the minerals, which are the calcium, the phosphate, goes inside the tooth and it forms the tooth. So that's mineralization. When we have the teeth and we use them, we eat, we brush, we sometimes use them to open cans, whatever we do. This is when we start to change that structure. So there are 3 reasons for having tooth wear.
Abuse the teeth.
I wouldn't say abuse. So there are 3 reasons why you can have tooth wear. Number 1 are acidic. The acidic drinks, the acid come from 2 sources, either from inside or from outside. So acidic beverages, because what they do is they soften the enamel and they demineralize it. And then this is when you start to lose the calcium and the phosphate on the enamel surface. So what we do is we give fluoride. When you give fluoride helps to stabilize the enamel. So we put acid, but it cannot take away the calcium from the enamel. That's the importance of fluoride. So acids can be in beverages. Now, people think that acid is just lemon, or acids are present in chips. I've seen the tomato chips, they have citric acid. It's in orange juice, tomatoes, in a lot of
drinks.
So some people, unfortunately, they take lemon and they enjoy sucking that lemon against their teeth, and they completely wear off their enamel. Orange, also sucking the orange. So I advise parents, no, please cut the orange and eat it properly, and then rinse only after you eat it.
Right.
Do not brush, because this already a process where the enamel is not very strong because of the acid. Then if you buffer it with the water, then it becomes buffered, and then you don't lose the enamel. Then you can brush. So eating salads with vinegar, and this is like normal. Everybody eats salad with lemon and vinegar. So all these acids from outside causes tooth wear. The other acids from the inside. So bulimia, for example,
reflux.
People who vomit a lot. People who have gastric refluxes, people who drink alcohol also, and then at night they start to have regurgitation. All these causes demineralization, but it's not a normal aging process. There is a reason for it. It's not a normal aging. It happens because we are not taking care of what we are giving to our teeth, like putting acids on it. And unfortunately, like today's children, 90% of their food is acidic, 90%. Between the sweets that are flavored with Coca-Cola flavor and cola flavor and lemon flavor and orange flavor, and then the chips with all these preservative, and then everything I taste that is made for the children have acids in it, unfortunately. So you see that today's children, our teeth are yellow because they've lost a lot of enamel over time, and they don't drink enough milk. They don't like milk. Most of the kids don't drink milk anymore. So I always tell parents, use flavored milk, chocolate ice cream, yogurt, flavored yogurt, camel milk. There are so many options of giving children calcium that helps build the bones and the teeth.
And fluoride applications as well.
Fluoride, definitely.
I have to do
they
it
need
with
it every 6 months.
6 months I do.
They have to put fluoride gel and use a fluoridated toothpaste for the kids. Just to go back to tooth wear, the other reason is using vigorous toothbrushing, the technique, or rough toothbrush. Or rubbing teeth against something. For some people, they like to put something in their teeth and keep on rubbing it, like miswak or other tools. I tell hairdressers, they put the hairpins in between their teeth, or some teachers hold the pen and bite on the pen. Children also use it to cut their nails. I've seen people opening cans and things with their teeth, and this is the abrasion, called abrasion, because it's a tooth wear caused by an abrasive. We have seen it also, people who work in manufacturers that have fumes. again, because of this abrasive, also when you horse ride in the desert and you have all the sand coming to your teeth, these are all abrasive. They can cause tooth wear. And then finally, something called bruxism. Bruxism, we see it in children and adults who are clenching their teeth like this and biting against each other, and they wear the surface of their teeth. In children, it happens as a natural process because when they do that, the new teeth grow up and the old baby teeth falls away. But in adults, it becomes a manifestation of stress, or sometimes if they have heavy muscular jaw muscles, they clench a lot. It can result in TMJ dysfunction.
I have got TMJ because of this.
But this is called bruxism, and the solution for that is to use a night guard. So when they are sleeping, and I tell patients, if you notice that you are clenching while you are driving, because it's stressful, you have cars, you are having to look at, like all the, sometimes they clench when they are driving. I said, just put the night guard during the day. It's called night guard, but you can use it during the day if you feel you are clenching, because it absorbs all this stress. So instead, I've seen patients who break a night guard like every 2 months because they bite on it so hard that it breaks. But I said, it's okay. If it breaks, it's more important for me than your teeth breaking off. So it's okay. If you're that stressful and you're breaking it, I'd rather have you break the night guard and not breaking your teeth. So yeah, we've seen all this. So as we age, we have tooth wear, but if we grow up with all this, what I've said in consideration, you might have an excellent set of teeth and you might not have demineralization. As long as you're putting fluoride, you're using soft toothbrush, you're not clenching, and you're not using acidic beverage and brushing immediately. You can have a set of teeth without losing any calcium or phosphate. I mean, it might be, but very, very mild. Like you will not need a proper reconstruction work as you grow up.
How can I do remineralization as an adult? Fluoride as in fluoride toothpaste?
Fluoride gel, fluoride gel. No, fluoride gel every 6 months help to remineralize the teeth.
At the dentist?
Yes.
Okay, applied by the dentist.
Yep.
And it is possible to restore the...
Okay, there are stages when we can restore. There are stages beyond restoration. So if you have lost a lot, we have to put fillings. If you lose your tooth structure, we need to put filling. Okay. The filling mean we restore it either with the resinous material or with the ceramic material. We have the two options. For example, veneers is a reconstruction material. So we build back whatever you have lost.
On top of the teeth?
Yes.
Okay, no. If some people want to...
But if you are in a stage where it is reversible, which means you still have the enamel, but the enamel's color change, it becomes patchy white. When we put fluoride, and also there is calcium containing paste that we use, the chances that it will remineralize is very high. So you don't have to, that would be enough. But there is a time when we are beyond that, like the tooth already is broken, then this is when we put restorative material.
So sometimes with the demineralization, it gets to a stage that it is irreversible.
Yes,
and you need
it starts reversible, and then it reaches a point when it becomes irreversible.
Because you haven't treated it early enough.
Exactly. So when it is in the reversible time, for example, you're putting a lot of acid, so your teeth are demineralized from the acid, and you can notice that they have white patches on it. In this time, you stop the acid.
Yeah.
We do the fluoride, and we sometimes polish it with calcium, and we do this for over some time. Then you might see that your teeth have gone back, and you're no longer having these patches anymore. But if you don't treat it at that time and you stop the acid, it will continue, and then you will continue to lose enamel, and then your teeth become sensitive because your enamel is gone. So it's only the dentine, and the dentine has the ending of the nerves. So you become very sensitive. Here we cannot do remineralization anymore. Here we need to put veneers, whether it is made of methyl methacrylate, which is like the restorative material, restorative resin, or we use the ceramic ones, which are the veneers.
So is it a good practice then, after all you've been saying involving the term fluoride, to just use good toothpaste with a percentage of fluoride in it and focus on fluoride application?
Definitely. That's what, this is the rule of thumb in dentistry. You visit the dentist every 6 months, you use a soft toothbrush, you brush 3 times a day, you use a fluoridated...
And you floss at night.
And you floss once at night, and you visit the dentist every 6 months. I have to emphasize that because a lot of people, they visit the dentist once in a lifetime. And then I say, okay, if you do it 6 months, I have to do 1 tooth, but now I have to do 22 teeth. And that means like a nightmare for you because you have to come every week. So we can finish 22. We have a lot of teeth, huh?
Dr. Hibah, let's talk about teeth whitening.
Okay.
And again, I will say that I read in so many places that teeth whitening, when done with Zoom, with whatever the technology is, I read that it increases the level of sensitivity to some people, and that level of sensitivity is irreversible. Is it mandatory for every single person doing whitening that they will have sensitivity?
Okay. The whitening happens from the gel. The gel is the one that causes the sensitivity. The sensitivity is caused by the gel. The tooth whitening gel contains a chemical, and the concentration of the chemical can cause irritation in the pulp. The pulp is the part that has the nerves inside the tooth. And it's called I can't remember the name, but what happens exactly is you have an inflammation, but it doesn't cause pain. But over the time, it causes stress in the pulp, and then the pulp dies. So it is all related to the concentration of the chemical. Now, the concentration of 5% or 10% does not cause that inflammation in the pulp. So the more strong the gel, the more damage you can get. The light that is used to activate the gel can be any light, LED, plasma, zoom, it doesn't matter. Because what it does, it activates the gel. The problem is in the gel concentration. I avoid high concentration. For me, it's not, the results are not predictable. And the sensitivity is very big risk. So once the dentist is using high concentration gel, it is expected to have sensitivity. It is expected to have subchronic inflammation in the pulp. And there are studies to prove that. So what I suggest for people who wants to do tooth whitening is to go for a dentist it doesn't matter what type of light. The light activator can be laser, can be plasma light. I've seen a lot of good results with plasma light. Zoom light is another product. There is the LED light. It doesn't matter. The machines just activate the gel. The real secret is in the gel.
Right.
Now, there are 2 types. There is home bleaching and office bleaching.
Yes.
The home bleaching is sometimes sold on the counter in pharmacies and people, or even in supermarket or in Amazon.
Yes.
But this product, you have to read exactly what is the concentration. That's number 1. Number 2, if you have crack in the tooth, if you have gum inflammation and you use this product, they can damage your teeth. So it's very important to do it under supervision of a dentist. So what we advise is, if you want to use home bleaching, you go visit the dentist, show him the product, and let him advise you what would be the best product that you can purchase. Because the home bleaching is a different technique. You have a tray, you put the gel in the tray, you keep it for 1 hour, and then you wash. What I suggest is that you do the office bleaching, and then you do the maintenance with the home bleach. So you get your teeth whitened, because the whitening does not last. If you eat spaghetti and salsas and turmeric and coffee and tea,
the teeth are porous,
smoking is an immediate damage. Like I whiten today, if you smoke tomorrow, the whitening effect is gone. So what we suggest is that you do the office whitening. You take all the measures to prevent the stain to come to the teeth, from avoiding smoking, avoiding colorful food, using straw when you are drinking things that can damage.
Yes.
If you drink coffee or tea, I always tell my patient, if you drink tea and you don't wash the cup, next day you try to wash it, the stain doesn't come out. Have you seen?
Correct.
The same with the teeth. If you drink coffee and tea and you don't clean with water, at least rinse, the stain doesn't go away. So always after drinking tea and coffee, just rinse or drink water and swish and that's it. That will help.
It's my first time to hear this. You see?
Yeah, I'm telling you, I always give an example because if you put coffee on a mug, porcelain mug, and you don't wash it for a day, and then the next day you come and wash it, the stain doesn't go. It becomes yellow, and it doesn't go away.
Yes.
No matter you try, it doesn't go away.
You are absolutely correct.
So if you want the effect of the tooth whitening to last, you have to do all this. A lot of people have to stop tea and coffee, and even green tea, by the way. You know that green tea can stain the teeth? People think because it's yellow, it does not stain the teeth. No, it does stain the teeth as well.
Okay.
And then maintenance can happen by using a tooth whitening paste. Again, it's not mandatory. A normal toothpaste can help as well. But what I suggest also is to do the home kit as maintenance. So the dentist is the one who purchases it and show you how to use it. There are so many products. But the mildest product are the best one. The one that does not have high concentration of the chemical, that is the one I suggest.
When someone gets sensitivity, as and when
there is an anti-sensitivity gel that we give the patient after the tooth bleach. So now I have my own technique. Reversible. So what I do is, okay, but this is a secret. I'm not supposed to say it. I don't mind.
I have my own technique.
Yeah, I'll tell you what I do. I polish the teeth with calcium after I finish the bleaching. Because I know with the bleaching chemical, you do demineralize a little bit the teeth. So I polish it with calcium paste. So I kind of try to remineralize the teeth. And then I polish it very high polish. And this is what a lot of people don't do. Because the high polish seal back the open dentinal tubule. Because the material, the way we put it is we open the tubules and then put the chemical, so it goes inside and it bleaches the teeth. So after that, the pores are open. So you need to close them. So we kind of polish the teeth, high polish. So it becomes really, you seal all these open tubules, and we put calcium to make sure that the remineralization happen with the calcium. And then the teeth will become not only white, but also shiny. It's like when you do your nails, you remember, you file them and they become very shiny.
Yes.
The same with the teeth. So your teeth become shiny and white and looking very nice. As I said, for maintenance, sometimes, because you cannot over bleach. Like over bleaching is when you do the bleaching less than 6 months. Because smokers, for example, after 2 months, they found that their teeth are yellow. They go back for another bleaching episode. And this is not good. But sometimes, for example, if the teeth are sensitive and the patient really need the bleaching, because she's an actress or someone who wants to appear on the front of TV, they want their teeth white, we do it over 3 weeks. So I do like 45 minutes, then the next time 45 minutes, until I get the color they really want. But then we maintain with the home bleach that has low concentration, but they can use it only 1 hour, and they can use it for 1 hour. They keep it on the refrigerator so they can use it whenever, but they can do it like once every 2-3 months, and it will keep their teeth white and shiny without having to do the whole procedure in the dental office. So this is the trick I use in order to maintain the whiteness without hurting the pulp, without the effect of the sensitivity.
So Hibah, should the teeth really be white? Like, in order to say the teeth are pretty, they have to be like in your face blue white? Because nowadays I see so many smiles, and because of how white the teeth are, you know that the teeth are either veneers or...
Let me tell you, the difference between veneers and bleaching. Bleaching just lighten the teeth. It removes the stains and it bring... So if your tooth color is like, say, A3, it will move from A3 to B1. But it's still natural color. You're not changing the color of your teeth. You are lightening it. Yes. Because... And the other thing that a lot of people don't know, sometimes I tell patients bleaching is not for you because the enamel is so thin, and the yellowness that you are seeing is the dentine color, which is the natural dentine color. And no matter bleaching you will do, it will still be there because this is the natural color of the dentine. Because the bleaching happens only in the enamel phase. When you come to the dentine, you cannot whiten the dentine. It does not.
So it won't
affect it
not
that much.
Not a good candidate.
So in these cases, if you really want white teeth, there are the options of ultra veneers, which are very, very thin veneers without teeth preparation. We just stick them on the teeth, and they are white in color, and we play with the color of the cement, so you can have your teeth very white or naturally white.
It's like a layer of
a very thin,
like
it's like
nail polish,
like a lens, exactly.
Okay.
But it's made of porcelain, so it's long lasting, and it's very fine and thin, and we do not prepare the teeth.
So
we do
it
not
will
damage
not
the
stain
teeth.
because it's made of porcelain.
It's porcelain. This is the color of the porcelain. If it's stained because of tea and coffee, it's very easy to polish at the dentist. You just need rubber cap and polish it. It's not a big deal. So the options when you want to have white teeth start from do nothing, because your teeth are nice, and accept that especially dark skinned people, their teeth color really show whiteness, and you really don't need to do much to do them. Just keep them clean and healthy. Then there is the option of doing bleaching, and you have options of home bleach or office bleach. As dentists, we do not recommend home bleach without seeing a professional, because buying some product can damage your gums or your teeth if you have problems. For example, if you have old fillings and then you use the home bleach, the ink, on the counter purchase, you might have severe sensitivity because of the leakage of the chemical to the dentine and around the old fillings. So you really, before bleaching, we need to check all the teeth. We check that there are no leaky fillings, there are no broken part of the teeth that can be affected with the chemical. The gums are healthy, because if you have bleeding gums and you put a chemical on it, you'll have more inflammation. So it's very important to use it with caution and with dental advice, it's not a pharmaceutical advice. Sometimes they ask the pharmacist. The pharmacist is not a dentist.
Dr. Google.
Okay, Mr. Google again. Yeah, that's another source of information. So now we always ask, you show the product to the dentist and say, I want to purchase this one. And if the dentist don't do bleaching, for example, it's a specialist, but find that this product concentration is within the acceptable level, the 5% to 15% does not harm the pulp, but above that, 25%, and there is 35% and 30%. I predict 90% of the cases will have sensitivity because it does cause inflammation in the pulp. Then there is the option of putting ultra veneers. Some people tell them lumineers or non-preparation veneers, which are very thin layer of ceramic facing. And this ceramic facing will give you the shape and the color that you like. So if you are on the camera all the time, we frequently see, actresses or actors and performers who are under the spots all the time. They like to have white teeth because it takes them so much time to audit.
Not frequently, doctor. It's like now all of them are doing it. All of them are doing it.
Anyway, but the important part is to use a color that suits your skin complexion. So just because there are some dark-skinned people and they go for the very bluish white color, and it does look fake. It does not look natural. For me, it's not a fashion. For me, veneer is a treatment that will last with you for your life. So it's something that will last for you 20 years, 25 years. So you don't go for
the veneers
colors
that we prep the teeth, that we file the teeth.
Okay. Today, there are so many technology that you don't need to prepare the teeth. Or like the preparation will be just to make a little seat for the veneer. So it comes, we call it emergence profile. So it comes out of the gum looking very natural. So you don't see that, sometimes I see a patient and I forgot that I made a veneer for them because they look so natural coming out of the gum because you can create a little seat for it. But if the teeth are not in a proper position, let's say it is out of or it is too long, or it is too short, you need to fix this. So this is when we do some preparations. But it's mandatory preparation. It's not like just because you want a veneer, I have to cut half of your tooth. And I've seen cases where the patient wanted a veneer, they end up doing root canal, cutting half of their teeth to have a veneer. I mean, this is completely unethical and unheard of. Like, why would you want to put a veneer and do a root canal to do a veneer? But this is a practice some people do because they make more money, of course. And then, so instead of the patient going for veneers, they end up doing root canal, crown preparation, crowns and veneers, and it's a long list of things that are not necessary. Young people, I do not advise. Like I have kids who are 16 or 17, and they come and they say, we want a veneer. If their enamel is strong, they should not have veneers. Maybe in this case, we can do tooth whitening, because it will give you the whitening you need and you don't need to put anything on your teeth. So there is no age for veneers. I always assess the case by case. So if the case has cracks, restorations, because for example, they ignored their teeth when they were young, so they have a restoration here, restoration here. The veneer will replace all that. So you can just hide everything, and they don't need to change the restoration frequently anymore. But as I said, it's case by case, and it's very important not to imitate other people, because sometimes God have given you a beautiful smile. Yes. You really don't need to change it. And just the fact that somebody else have a whiter teeth than yours doesn't mean that you're not looking beautiful or your smile is not nice. It's all about confidence. And I've seen patients who don't smile at all because they are so ashamed of their teeth. And the minute you give them a smile makeover, their life change. They become confident, they smile all the time, they want to be in pictures, it changed lives. And this is the art. It's an art and a science and moral as well. So it's not enough to have the, it's unethical to do something for a patient who does not need it. And I see cosmetic and veneers if I want to do it, I will do it because it's a functional thing and it's not just aesthetic. So if you don't smile, if it's affecting your self-confidence, if you are feeling, or if you cannot eat, or it's causing crowding of your teeth, or there is something like damaging to your health, this is when you have to do it. But in general, my advice is to go for the minimum abrasive procedure. As I said, the lumineers or the ultra veneers, they call them many names because they are very thin and we don't prepare the teeth, are the best alternative, because if you don't like them, you can remove them. So it's not going to damage your teeth. But the old procedure that you cut 0.7 millimeter of the tooth to put a veneer is not anymore practiced in good dentistry. But in the old dentistry, yes, we've seen it. Yes. Most of the new modern dentistry, we do not remove from the teeth unnecessary. Like if I don't need to cut, I don't cut. But also, again, it's case by case. You cannot say like it's for everyone.
Yes.
And when it comes to the color choosing, we have bleach color and we have natural color. So I can choose natural color, or we can choose a bleach color. So for me, my always choice is the least, like in the colors we have 0.1, 0.2, 0.3, and 0.4. Yes. 0.4 and 3 are the more natural looking, 2 and 1 are the more white and like eggshell color.
Yes.
Doesn't look natural. But I've seen, it's cultural, by the way. I have a patient from Ghana, and he told me, in order to look rich and influencer, you have to have white teeth, a nice watch, and a nice shoes.
Yes.
So it's part of showing your wealth that you've done veneers. Yes. So they go for the whitest color.
Yeah.
I found that interesting because, again, the choice of the color is, the patient's the one who's going to have this teeth forever. Yes. It's not me. Yes. I would give them my advice, but sometimes they insist that I want them this white. I cannot tolerate my teeth being not white. Yeah. But as I say, these are going to last with you 25 years. So you have to choose the color with conscious that it's not a trend. It's going to last forever. So you have to choose a color that match more with your color, skin color, and your complexities. It's matching color. It's not too odd.
Yes.
So you look at a dark skinned person and his teeth are blue-white. It does not, it looks fake, and immediately people recognize that this is not a natural smile.
That is correct. That is correct.
Plus the shape of the teeth.
Of course, the shape. Speaking of the shape of the teeth, and speaking of the veneers and the Hollywood smile and the social media smile and all of this, this brings us to a very important part here that is called Mythbusters. It's some sort of myth that we hear about, we read about, but I would like you to clear it for myself and all the viewers watching this episode. So here comes Mythbuster number 1. Cosmetic dentistry is for the rich and wealthy only. Average people, poor people can't afford it.
Not true. Not true. Cosmetic dentistry is a big general term. It means that makes you more pretty. Cosmetic dentistry start from tooth whitening to veneers to resonance restoration. The mission is to enhance your smile and make you look more pretty. So it doesn't have to be something only rich people can afford. It is the dentist who made it expensive, so only rich people can afford it. But any dentist can do cosmetic. I'm not saying like it's restricted to rich people. The most important is that dentist has the eye to recognize that this tooth is not in the right place or not, because part of cosmetic is orthodontic treatment, because we enhance these. Look, it's so, and now we have invisible aligners. So these are like plates you put in your teeth. They align the teeth, and they're not expensive. Maybe orthodontic treatment is 15,000. Aligners can start from 2,000 to 3,000.
Yes.
So what I'm saying is not limited. It's not something related to money. People like to show off that they have good teeth, but in general, cosmetic dentistry is the term given to any procedure that enhance your smile and your beauty and your self-confidence. And that can range from orthodontics to a lot of procedures, even gum lengthening. Sometimes you have gummy smile where the gum is so low, and just doing a laser contouring will enhance your smile. So there are so many procedures under cosmetic, and any dentist can perform them. What I just suggest is to go for a dentist with an art eye, like artistic eye, so they can see if something is odd. Is it the color? Is it the position? Is it the shape? Is it the gum line? And then they can enhance your smile with very simple things. Sometimes just recontouring some of the teeth and make the smile line looks better, whitening. So it's not limited to rich or poor. It's just going to the right person who can enhance your smile and give you what you deserve.
So many people can actually afford it. So it's not for the rich and wealthy only.
No.
Teeth whitening damages enamel. True or false?
Tooth whitening done in a non-professional way and with a chemical that is very highly concentrated can damage the teeth. So I wouldn't say it's no. It is true, but saying that if it's a low concentration chemical done with a good professional, it should not be damaging
then there is
the
no
tooth.
damage. Veneers make your teeth look fake.
We've just answered this question. Veneers can enhance your smile
for as long as you
choose, as your dentist choose the right shape, the right color, and the right position, like the right thickness for your veneers. And as I said, now there are technologies where you can also show the patient before they do any procedure how their teeth will look like after they finish. There are so many dimensions of enhancing the what we call Hollywood smile, or giving you that beautiful smile. But definitely veneers are a tool that we use all the time to enhance the whole smile. And it is expensive. It's not cheap. And when I hear some people saying, I can do all my teeth for 3,000 dirham, I feel scared, because I know that whoever is going to do this for them is going to, like he's a fraud. It's not going to be a good job.
Okay.
It is expensive because it's a lot of teeth done, and good labs, they charge a lot.
And the material is
and the good, and now the technology is it's called CAD/CAM technology, so that it's automated, they scan, and these machines are cost millions, so that's why it's an expensive technology. But again, as I said, you can still do it for a lower price, but you have to be careful of very cheap ones, because these, I'm not sure what kind of material they're using, the longevity, the lifespan of this procedure, how long it will be lasting before you're going to have problem, or they crack off, or they break. These are all things that we can think of, and I found it very interesting to know how can these dentists afford to do it so cheap, because I know if you go to a good dentist and a good lab, it is not cheap. It cannot be very cheap, and that's what I'm saying.
Okay, so basically here what we're trying to say is, yes, you can go and do veneers, but you have to make sure that you know a lot about the dentist who's going to perform it, and cheap veneers don't exist in the dictionary because it's not a cheap procedure. Doctor, bad breath means I'm not brushing well enough?
It's an interesting dialogue, because bad breath has nothing to do with your brushing. Bad breath can be from some food you have consumed. It can come from the stomach. Sometimes you wake up and you just have bad breath because of the gas coming out.
Yes.
Again, this is very interesting. Sometimes if you have sinus infection or sinus inflammation or sinusitis in general, it can cause bad breath. Smoking can cause bad breath. Gum disease can cause bad breath, and dental decay cause bad breath. So if you have badly broken teeth and badly decayed teeth and plaque in the teeth in the mouth, yes, it can cause bad breath. So if I go to the myth again, I would say that if you ignore brushing your teeth and you leave it for the food and all these bacteria, there are chances that you will have bad breath. But again, this is what we notice. People who don't brush their teeth in the morning and you get close to them, they don't smell.
Of course.
There is an odor. Yeah. And the odor is coming from the fermentation of the food particles that have stayed overnight in their teeth, and it's smelly. But in general, bad breath is not just related to ignoring your toothbrushing. It is related to many factors, and mouthwash is one of the things that can help a lot.
Yeah.
But professional treatment of the gum. And we didn't talk about this because gum disease we call it the silent killer, because it takes away the bone around the tooth, and then you will notice that the teeth are starting to become mobile, and then you lose them. So it's very important not only to clean the teeth, but also to remove the pockets around the teeth. And the deeper the pockets, the more chances that you'll have the bad smell, the sensitivity, all this comes from gum disease. And we were talking about bad smell, and this is what I wanted just to bring to attention, that gums are very, very important. And the healthy gums comes with good practice of brushing your teeth and visiting the dentist every 6 months. I know you had dentists, but...
But no, I can't really stop listening at everything that you're saying, because you said so many things that no matter how much I read, you're saying things that it's my first time to hear about, and I can't thank you enough for the amount of information that you shared.
Thank you very much for having me
today. Definitely.
I really enjoyed it because, I've been practicing for so many years, and I've seen patients with different problems all the time. And the biggest problem is in the head when they don't want to go to the dentist because they are scared. That is the biggest barrier, because if you ignore going to the dentist for a long time, you will go so many troubles, so many problems. I say if you come every 6 months, we will have 1 tooth or 2 teeth to treat. But when you leave it until it is, 20 teeth to treat, then you're really having to pay a lot of money. You have to come a lot of times, and you have to do a lot of procedures. And the worst thing is when we find that the decay is too late, we have to do root canal, and then it's a root canal, and then rebuilding the tooth, and then crowning the tooth. It's a lot of cost and a lot of time.
Yes.
So it's very important to remove that fear from the head and think of if I really want to have a good lifestyle. And you know what, also, in the UK, every 6 months, the dentist reminds you to come and do the checkup. And it's free of charge. But it's just to prevent the cost of treatment, because the cost of treatment is very high.
Yeah.
So on the government side, they ask every neighborhood to have a dentist, and the dentist he's obliged to send you a reminder to come and check your teeth every 6 months. Yeah. And I've been running after my patients. Come, it's 6 months already. Please come, let me see your teeth and do the checkup. They only go when they have pain.
Okay, but here, no one's going to be running after you. What Dr. Hibah is trying to say is, visit your dentist regularly, look after your teeth, have a very good routine, and have a wonderful time, everyone. Thank you so much for watching. Thank you very, very much, Dr. Hibah, for being with us and for sharing.
Thank you very much. And I really wish all the audience to benefit from this episode, because I really enjoyed doing it with you, and the questions were very interesting. And the other thing is that if you find a good dentist, I said dentist and hairdresser, you don't change them. Because they know the history.
True.
So some people, they hear a new dental practice have opened, they jump to that one. But your dentist who's been with you for so many years, he have the history. He knows what he have done. If I have a patient and I have a faulty filling, I go open my file and look, okay, when we did this one, we did it 9 years ago. It's time to change it. So this history is lost when you keep on jumping from one place to another. Build a good relationship so you can trust that person. And I have patients who come all the way from England or from other countries, because they say we don't trust anyone but you. And this is like, for me, it's an honor. Like when somebody really trusts you because they know that they have been through a lot of people and none of them give them the right advice for their teeth. And honestly, it's very the dentist who tells you this is not a procedure for you, he's giving you a favor. When they tell you veneer is not for you, don't go and seek another dentist who tell you I will do veneers.
Right.
If your dentist say you don't need it and he's a good dentist, trust him that this is a procedure that would just cost you money and it's not going to benefit you as much. As I said, I really enjoyed the episode. Thank you very much.
Thank you so much.
It's been a lovely evening. Thank you.
Same for all of us. Thank you very much, Doctor. Thank you very much, everyone. And see you again soon on another episode with Podcast with Wagida. Ciao.